Hello, my name is Maya, and today you'll be hearing from Shell, Camila, and I about Huntington's disease. I will be going over the general structure and function of the organ systems that are affected by Huntington's disease, along with the details of how the system works to maintain homeostasis and how this homeostasis is disrupted in the first place. Shell will have a discussion of the disease and the lifestyle choices that disrupt the organ system homeostasis. And finally, Camila will be discussing the demographics of the disease. First of all, what is Huntington's disease? The Mayo Clinic defines Huntington's disease as a rare inherited disease that causes the progressive breakdown or degeneration of nerve cells in the brain. Huntington's has an extensive impact on a person's functional and cognitive abilities. Huntington's disease looks different for every person who has it, as it can affect a variety of bodily systems. The main stem causing Huntington's disease involves the HTT mutation on chromosome 4 in the DNA segment CAG trinucleotide repetition. This genetic component causes the parts of the basal ganglia to degenerate. Though deep in the brain, the basal ganglia helps to indicate the smooth out muscle movements, suppress involuntary movements, and coordinate change in posture. The basal ganglia is also a part of the central nervous system within the nervous system and is made up of subcortical structures which form a part of the extrapyramidal motor system and work in tandem with the pyramidal and limbic systems. Typically, the nervous system is involved in receiving information about the environment around us and then using that information to create responses in each situation. The nervous system has two main branches, the central nervous system, and this is where Huntington's disease symptoms arise, and the peripheral nervous system. These two systems allow our bodies to understand external stimuli and adapt to our situations. As stated previously, people with Huntington's disease have a part in their brain, the basal ganglia, which is deteriorating, making people with this condition not be able to respond to situations, have difficulty controlling movement, and overall just taking care of themselves. With this part of the brain deteriorating, people with this disease start to experience symptoms with a range of physical, behavioral, cognitive, and psychiatric problems. This disruption of homeostasis is because of the basal ganglia causes a production of mutant Huntington protein, or MHTT. This protein aggravates in the cell, cytoplasm, and nucleus, affecting cellular function. The number may also increase upon cell division, and the length of the repeat is correlated with the age of onset of this disease. Huntington's disease exhibits a high penetrance, meaning that those who inherit the mutant allele will have the disease. This stem of conditions and problems branch affecting other systems such as the muscular, digestive, and respiratory systems. Symptoms typically start as loss of control of involuntary movements, and can eventually lead to a person being confined in bed and unable to speak. Huntington's disease is an autosomal dominant recessive gene. This means no matter your lifestyle choices, you cannot do anything to prevent Huntington's if you have inherited it. It is recommended for families with a history of Huntington's disease to have genetic counseling before having children if they do not want their children having or suffering from this disease. Unfortunately, there is no way to slow the progression of Huntington's disease. Symptoms typically start between the ages of 30 to 50 years old, but those who have juvenile Huntington's disease symptoms can appear in younger adolescents, even starting around 2 years old. The U.S. Food and Drug Administration, or the FDA, did a series of reports called the Voice of Patient-Focused Drug Development Initiative for Huntington's disease. In this study, they asked people with Huntington's disease about current treatments and if they were helping with symptoms. Patients responded stating that current treatments do not adequately manage their most disabling symptoms. Some medications were effective in managing some symptoms. Most treatment regimens were altered to add more medication or increase dosing as Huntington's disease symptoms progressed. Patient symptoms are not being managed as their symptoms progress over time. Not monitoring or changing this leads to more discomfort and pain for the patient suffering from Huntington's disease. Finally, these patients went on to stress the need for medications that are effective in delaying the onset or symptoms, or even just slowing the progression of the symptoms. The solutions we have now are not currently plausible, but having these would improve these people's lives so greatly.
My name is Shellanne Strozzi, and my portion in the homeostasis project was part C, discussion of the disease, lifestyle choice, diet, exercise, drug ingestion that disrupts organ system homeostasis. The disease that we decided to choose was Huntington's disease. So I'm going to begin. Huntington's disease is an inherited disease that is extremely rare. It's a genetic disease. This disease causes the breakdown of nerve cells in the brain. Huntington's disease significantly impacts individuals' abilities to function by themselves, which typically will result in issues later on. Typically, if you have Huntington's disease, you will develop anytime throughout the lifetime, but it's typical around 30 to 40 years that you'll start showing symptoms of this disease. If you show it symptoms anytime before 30 and 40, and it's under the age of 20, it's juvenile Huntington's disease. When it does create earlier, like when it does show up earlier, it's typically much more progressive and violent. There are a variety of different symptoms that come with this disease which can lead to other symptoms from it. So first are the symptoms of Huntington's disease, which can be the movement disorders, cognitive disorders, and psychiatric disorders. Movement disorders can include issues with involuntary jerking, which is called chorea, muscle issues such as rigidity or muscle contracture, problems with speech, swallowing, impaired gait, issues with balance and posture, cognitive issues that can be tied to Huntington's disease can be challenging to organize and focus thoughts in a timely manner. There's a big lack of flexibility, awareness, and impulse control, slowness in processing different thoughts and finding words, struggles in learning and teaching new information to others, having a difficult time holding conversations. Psychiatric issues that can range from Huntington's can go from irritability, social withdrawal, insomnia. In addition to these issues, there's usually fatigue, a loss of energy, frequent thoughts of dying or suicide, can become aggressive. These symptoms often coincide with obsessive compulsive disorder, mania, and bipolar disorder. With all these symptoms that are tied with Huntington's disease, there are life choices that can reduce the onset of all these conditions and help to decrease the severity of the symptoms. Two big life choices that can be changed are the eating patterns and the stress factors. Stress can be summarized easily, which is the stress response protects under critical conditions. Still, when it is activated, it can cause health issues and accelerate the onset of this disease. If humans are constantly mobilizing energy compared to storing it, there will never be fully a surplus of energy. This can lead to chronic fatigue. For example, if our blood pressure rises every single time we think about a test or pay the phone bill, this will then increase the risk of cardiovascular disease.